We see many normal-sized postmenopausal women who develop breast cancer without having an obvious hereditary cause, and the question is why. To evaluate this question, we utilize data from the Women's Health Initiative, and we're able to obtain data from 3,460 women who had objective measurements of body fat using a technique called the DEXA scan. And based on these results, we were able to demonstrate that normal-sized postmenopausal women who have excess body fat have doubling in their risk for estrogen-dependent breast cancer. So the implication is that there are many women walking around who have a normal body mass index who think they're fine, but are not. They have an increased risk for breast cancer, and more recently we've shown that the same group of women is also at increased risk for cardiovascular disease. The implication being, at least in my opinion, we can begin to screen women and identify this high-risk group, and then the question becomes, once identified, what can you do? And that is a cutting-edge research question, and we hope in the not-too-distant future to begin to do studies to try to evaluate exactly what we can do to shift a normal-sized woman who has excess body fat and increased risk into a lower-risk group. Body mass index is based on weight and height. It doesn't tell you anything about the quality of the weight. What our study demonstrates is that BMI is a woefully inadequate proxy for health risk when you fall in the normal range. You can have normal BMI, but if you have excess body fat, at least in the postmenopausal state, you will be at increased risk for both breast cancer and cardiovascular disease. I can tell you that what we are hoping to do is a study in the future whereby we identify these high-risk women using the same criteria as in our recent publication, identify them by DEXA, find women in the high-risk group, and then randomize them to a treatment which includes a modest caloric restriction plus exercise versus usual lifestyle to investigate whether or not in a reasonable amount of time with reasonable effort we can shift a woman from the high-risk group to a lower-risk group.